Hello, my name is Brian Heminger, and this is my internship presentation for the fall 2024 semester, which covers 50 hours of my internship at Diablo Valley Physical Therapy and Sports Medicine Center in Danville. Why I chose to do physical therapy for my internship, the purpose was to gain hands-on experience observing physical therapists and exploring whether this is a career I would like to pursue and learn more about the treatment modalities that the therapists utilize in each session. Some of the physical therapists that I followed were Steve. He focused a lot on gait analysis, ergonomics, and had a good sense of humor to work with each patient and figuring out how to help them best with each different movement that they were challenged with. Some people couldn't even walk without assistance. Some people were just looking for a better gait and rehabilitation after surgery maybe a few years ago. Megan, she worked with a lot of post-surgery types, clients that had knee replacements, for example, and different pain management techniques. Nicole focused a lot on sports rehabilitation. She had clients with like tendinopathies a lot of the time, or maybe just were having issues with being able to get the full range of motion back. She used cupping and ultrasound techniques and a lot of corrective exercises. Then I also shadowed with the physical therapy aides. There were about a half dozen aides I worked with usually, and so they would show me how to do the handoff and then implementation of the treatments as dictated by the physical therapists. The overview of the clinic, it was an outpatient physical therapy clinic that had served the general population. This focused on post-surgical rehabilitation and then gait retraining as a major focus. There were a wide variety of modalities that were utilized and exercise equipment. Here's a few pictures showing each one. The lower left-hand one, we have TRX straps, and then there's the stability balls in the background that were used a lot for like ball squats or different hamstring curls. There's also small hand weights that were used when they were transitioning from treatment to corrective exercises. And then the middle picture shows the typical room that I would set it up as. So that was how they were supposed to look. There's a little cabinet on the left side. I used all kinds of stuff in there, like pillowcases and then the spray bottles to sanitize everything. And then also learning how to use the actual tables. There was a little foot thing you can see that underneath the table where you pressed on that and it would lower and raise the bench to be able to work on patients. And then on the right hand side, there's different shuttles. These were used to take the weight out of a client as they were pushing through on a squat. So that was used a lot for knee replacements. And then the next slide here, answering the question of how the professional field experience is related to kinesiology and the courses I have taken. So my long-term goal is to be a physical therapist, and so shadowing physical therapy was an ideal way to understand what they are tasked with during their everyday sessions and how they interact with clients. It also broadened my knowledge of fitness and how fitness can be used as a corrective exercise, and then how the human body works by understanding different treatment approaches and modalities and why each practitioner utilized that different treatment over another treatment. And then how exercises can be used as the cure for different physical ailments and conditions. Um, and then all the courses, musculoskeletal anatomy, big time, biomechanics, huge, exercise physiology, even. All of those broadened my knowledge base for what each physical therapist would use. Then we have their question of how the professional field experience was helped me to my career goals. It taught me how to put into practice what I've learned at Cal State East Bay from classes like musculoskeletal injuries, things that we've covered in that class, tendinopathies, broken bones, or orthopedic surgeries, so orthoscopic surgeries, I mean. So learning how to the usual flow of employment went from patient check-in to questions and treatment progression, how to hand off to aides at the end of the session, and then how to deal with a wide variety of personalities, how to use humor when things got a little serious, or and also how to manage time well. I learned a lot about how to do the insurance and charting. I didn't know much about how the insurance was integrated into the physical therapy session, and that actually turned out to be a huge part of what they utilized. They had to be able to show a certain amount of progress each session, and for the insurance to cover the different physical therapy appointments. So that was new to me, and then also how to do that charting to prove that they are making progressions. How to deal with facility operations was big. Stocking, cleaning. So I got to see how to order and then stock the different things that they needed to stock, how to clean the different equipment. And next question, how a multiple-disciplinary approach to kinesiology can strengthen my professional practice. So physical therapists utilize a lot from anatomy and physiology, concepts from like biomechanics to achieve treatment outcomes in the clinic. Progressions in exercise treatments by increasing the moment arm during a movement and makes the exercise more challenging by applying more torque during the movement. So they might have them put their leg out a little farther for the squat, and that would challenge it, put a little more torque as they bend down into it. Steve would use a lot of ergonomics and biomechanical concepts with his clients. He would train them on gait patterns and progressions by having them walk across the room while they put their hands on their shoulders, and then he would watch them move. And then going up and down stairs, how they would put their center of gravity over the foot as they'd walk down. And so people have different challenges based on the conditions they had, and he was retraining them on how to do that. Um, so he would then analyze any dysfunctions in the movement, and it was really subtle. He would give them all these subtle points, and then you would see them, and it would you could see them walking completely different. So that was really eye opening for me of how to use even just something like that as a gait analysis is a huge part of the appointment. I've used a few different modalities and treatments that we use. So there's the game ready machines. They would use compression and cooling or heat at the injury location while providing electrical stimulation to the muscles at the same time often. So they would hook up the left-hand side. You can see the game ready machines, and then they would be filled with ice, and then there was a certain line with water. So I would do that a lot of the time. I would help them fill these, and then you hook up a hose that went to the middle picture here, which is the game ready compression, and so the hose would push the cold water into the injury sites. And there's different ones they have for the leg or the hip or the shoulder or arm, depending on what the injury was, and we would use different ones for that. And then on the right hand side, you'd use some tongs and pull the heat packs out of the hot water. So that would be used if they would need heat instead. Then the next picture here, we have the electrodes. On the left-hand side, you can see it's the machine, and that would use a different pattern depending on what kind of electrodes they were using. You had to apply the electrodes so it went across the muscle so they would shock it appropriately. And then being able to align it correctly was a subtle thing to watch, but a good experience to be able to understand how to put them on better. And then there are other things like the exercise bike in the middle they would use to be able to. A lot of clients would come in and use it before the session, warm up for about 15 minutes. And then on the right hand side is in a zero gravity kind of a treadmill where they would go upright, but then they'd be in this harness that they would zip up, and then that would take a certain amount of their body weight out of the movement. So it was a great way of being able to put them onto something that they've already done a lot of, like treadmill, or let them even go through running, but at a very minimized amount of body weight actually impacting. So great for knee replacements. Then we have the conclusion and key takeaways. So I learned a lot about how treatments work, what the kind of things the physical therapists do, how the progression for those treatments look like, at what point do they move from doing scraping and range of motion checks to moving them to a shuttle and having them start to do body weight squats at a very reduced amount. Um, One great example was Cindy. I would see her week after week working with Megan, and she had a knee replacement. She was at 80 degrees, and there was a lot of swelling, and then the swelling reduced, and she could move her knee a lot further back as the weeks went on. So over the course of 2, 3 weeks, I saw her go from 80 degrees of flexion to 110 degrees of flexion, and then how she would chart that and make progressions. And they would start at 3 days a week, and then went down to 2 days a week. So that was great to be able to see how the progression worked and how the therapist dealt with that. Also with her, it was great to see how pain is managed because that was something I didn't expect. And then how much pain to put a client through, what's normal pain, because they're going to experience some level of pain, even with the pain meds that they were on. And then also how the physical therapist works with the patient on being able to taper off of those pain medications. When do you taper off and how hard to push them? So that was a great takeaway as well. And then just what the day-to-day life looked like for physical therapists, how they come in, when do they, how fast do they work with each client, when do they take their lunch, um, how do they handle when they have another patient waiting. And so a lot of time management, a lot of charting, a lot of rationalizing to insurance, and then a lot of the handing off to the aides and being able to tell them quickly what kind of treatment they need to do, ice, heat, or stim, and how long to do it, and then how to implement that. So I spent a lot of time shadowing the therapy aides in that regard, being able to understand how they would implement those treatments, along with cleaning facility, doing laundry, folding, and then ordering and stocking the different things that were needed. So that is it. And thank you so much for watching.